This is County Executive Warren Evans, and this is Inside Wayne County.
Hello and welcome to Inside Wayne County. I'm your host, Lloyd Jackson, and with this show we want to give you important information and also keep you informed about what's going on inside Wayne County government. Today we want to give Wayne County retirees important information as it pertains to upcoming changes and their health care. Wayne County is dedicated to creating a supportive bridge to help retirees through this transition and ensure they're not left alone to figure out how to navigate through the enrollment process for new health care plans. As a result, we've enlisted the help of AmWINS, a leading provider in retiree healthcare solutions for over 20 years, to provide individualized customer support and assistance as retirees make decisions about their healthcare plans. Later in the show, a representative from AmWINS will join me to walk you through the process and the options available. But first, I want to introduce the viewers to the Director of Personnel and Human Resources for Wayne County, Tish King, who is here to explain the change and why it's happening. Tish, thanks for being part of this very important Inside Wayne County.
Thank you. Thank you for having me.
So explain the changes in retiree health care.
Sure. Effective December 1st, Wayne County will no longer provide group health care plans to retirees, to a large group of retirees, but instead we'll offer a monthly stipend plan that they can use towards the cost of health care. But I want to be clear that Wayne County isn't discontinuing its financial support of retiree health care, but rather changing the way we provide that support to retirees.
So was there a particular reason why a change was needed in retiree health care?
Well, as you know, Wayne County is facing lots of financial challenges, and part of those challenges involve long-term liabilities. And part of what was identified in the recovery plan is that 43% of our structural deficit is attributed to healthcare costs. So Wayne County Executive Evans, he just had a call for all the stakeholders to have shared sacrifices.
Now I imagine, Tish, that this is going to be quite a transition for the retirees. What's next? What can they expect?
Well, it is. It's going to be a transition, but we have taken great effort in planning and thinking about the easiest way to make this transition not so difficult and support the retirees in this. We've taken a lot of steps to ensure that they have that bridge of support. For example, we have partnered with AmWINS as a customer service support, and they will walk the retirees through the entire process. They will provide expertise in giving them information about healthcare plans and what best suits them and their eligible retirees. The group and the team at AmWINS, they have lots of expertise, knowledgeable. They'll provide that support and be able to help the retirees develop the plan and make the decisions that best suit their needs.
It appears to me, too, that Wayne County really wants the retirees to have that deep understanding of what's going on, and so there have been some informational meetings set up as well. Can you talk a little bit about that?
Sure. Like I said, we want to make sure that this transition is as easy as possible. So we want to make sure that the retirees have all the information that they need. So we have set up a number of informational meetings in Wayne County, some that are in Mcmahon, that will take place in Mcmahon and Oakland County, to accommodate those who live outside of Wayne County. But there will be an opportunity. We know that some retirees need that face-to-face interaction, that they want to hear, ask their questions and have someone very present to be able to answer those questions. So we set up the meetings, a number of them, and the meetings will be structured to give information about the medical and prescription drug plans, and we'll have representatives from Wayne County and AmWINS there to answer those questions.
So Tish, I'm a retiree, and I know this program is going to change, my health care is going to change. How do I prepare? Is there a way to prepare for it?
Well, you'll start to receive, the retirees are receiving, or if they haven't already, will receive notice of eligibility for the Medicare eligible retirees, and also they'll receive verification of employment forms for those pre-Medicare eligible retirees. What they need to do is to complete those forms and get them back, and that will determine their eligibility and what their stipend amount and levels will be. So they return them, complete locate them in the prepaid envelopes and get them back. And then the next step is they'll get a welcome enrollment kit from AmWINS, and that packet will include all the information they need about the plans, how to enroll, and then that gets the ball started, and the AmWINS is there to support them and walk them through the entire process.
It seems like that you've created a lot of different ways to get this important information in the hands of the people who need it.
Yes, we absolutely did. That is extremely important to us, that Wayne County retirees get that support. We don't want anyone to feel as though that they're scrambling to make decisions about their health care, that they're not able to understand the information. So we've taken great measures to create timelines and mechanisms of support to bridge that gap and be that bridge of support to retirees, so that they will understand what's the decisions that are facing them, and that they will be covered under the new plans that take effect December 1st.
Now, there is a website. We can go to waynecounty.com and we can click on the retiree stipend program, and then there is a number as well we can call.
Absolutely.
And that's 1-877-847-9906.
Yes.
Tish King, thank you so much for being part of this very important edition of Inside Wayne County.
Thank you. Thank you for having me.
We'll take a quick break and come back with Ed McManus. He's Vice President of Sales for AmWINS, the company who has partnered with Wayne County to educate retirees on the transition from the current employer-paid group health care plan to the county's retiree stipend program. We'll be back in a moment.
To be a good father is the most important job in a man's life, but it doesn't have to be hard. Play catch, go to a park or visit a zoo. Help your child with their homework. Sit down together for dinner. Ask them how their day was. Things get busy, and sometimes we all fall short. But the smallest moments can have the biggest impact on a child's life. Take time to be a dad today.
The Detroit Department of Health and Wellness Promotion local maternal and child health program is designed to improve the health of mothers, infants, and children. Safe sleep classes are offered to caregivers to learn safety precautions to prevent sleep-related infant deaths. Parents and caregivers should remember the ABCs of safe sleep. A. Alone. Make sure there are no blankets, pillows, toys, stuffed animals, or bumper pads in the crib. B. Back. Babies should sleep on their back. It's easier for them to breathe because nothing is blocking the baby's mouth or nose. C. Crib. Babies should sleep in a safety-approved crib, bassinet, or a pack-and-play. S. Smoke-free environment. Keep your baby's air clean. Babies who are exposed to smoke are 5 times more likely to die of sleep-related causes. Here are other ways to keep your baby safe.
1. Room sharing, but not bed sharing. With room sharing, you will still be close to your baby and the baby will be safe. The second thing is the temperature of the room. We want to make sure that the baby is not overheated. The room temperature should be between 68 and 72 degrees.
Safe sleep classes are held every 4th Tuesday of the month at the Family Place at 8726 Woodward Avenue. For more information, call 313-410-5264.
Hello, I'm Lloyd Jackson, host of Inside Wayne County. I want to take a moment to speak to retirees of Wayne County. In the coming weeks, you will receive a packet like this from AmWINS that contains important information about a change in your employer-paid group health care plan. This very important information will not only explain the change that takes effect on December 1st of 2015, but it will also provide helpful information on available healthcare options. We also realize that you might have some questions, so we've created 3 ways for you to get your answers. We scheduled information meetings in Wayne, Oakland, and Macomb counties where you can learn about new retiree medical and prescription drug plan options. You can call the AmWINS Customer Care Center at 877-847-9906. And information is also available by going to the homepage of waynecounty.com and selecting the Retiree Monthly Stipend Program box. We hope that these resources will help you make the best decision for you and your family.
Is AT&T your cable provider? Want to stay up to date on what's going on in Detroit? It's simple as taking the remote and changing the channel to 99. Just go to Channel 99, scroll down to Detroit and click. There you'll find Channel 10 and 22 and great programming from the city of Detroit.
We're back with more Inside Wayne County. I'm Lloyd Jackson. We continue to discuss the changes in health care for Wayne County retirees that go into effect December 1st. With me is Edward McManus, Vice President of Sales for AmWINS, a leading provider of retiree health care solutions for over 20 years, which has partnered with the county on educating some retirees about the health care changes. Ed, welcome to Inside Wayne County.
Thank you. Nice to be here.
Let me start by asking you about the relationship between AmWINS and Wayne County.
Well, recently we've been involved with Wayne County to assist them in the onboarding of their retirees, going from the program they had before to one that is part of what we've offered the county beginning the 1st of December of this year.
Walk us through the process of what AmWINS will do to help retirees better understand what's going on with their health care.
Sure. The process can be daunting for people, particularly that age group. Never having to buy health care in the past, this is something that's new to them. So we provide all the educational support, and I like to focus on the word education. To give proper service, we need to educate the client as to what their expectations are, what plans are available, what they can get for their stipend dollar. This is all very important part of the selection process, and we want to make sure we do it right. And we're available 8 a.m. to 8 p.m. Monday through Friday to answer any of their questions or take care of any of the fears they may have in entering in this new environment.
I know there are some questions about retirees who are Medicare eligible and are pre-Medicare eligible.
Sure, absolutely. Yeah, there's two different classes of retirees. Ones that are we call pre-65. They have not aged into the Medicare system. So they'll be handled differently with healthcare benefits that are available on the open exchanges. The retirees that are post-65, a different class, they'll be handled with a group option as well as individual options if they so choose to go that route.
And then packets are being mailed now, or some have received, that will go to the separate classes.
Exactly.
Each one.
Each class will have a different message, if you will, within the actual kit itself. The kits per class will be identified by those that are pre-65 and those that are post-65 Medicare eligible.
I'm sure questions are, we talked about stipend. They want to know, okay, well, how does that work? How does the stipend part work?
Sure. Well, the stipend is really what's going to help cover the majority of the cost of their health care. Essentially, the stipend is looking at stipends around the country that we're involved with. The stipend is pretty generous, and we've been able to put together plans that for very little money out of pocket, they can get some very excellent coverage.
So people will be able to speak with a representative from AmWINS and really get taken right through the process, the enrollment process, because then there's a little bit of fear, I'm sure. Because like you said, they've never done this before.
I think of my parents, they're now deceased, God rest their soul, but honestly, if they were being handled by these ladies and men that work in our call center, I'd be particularly pleased with the service they get. That's how much I'm convinced these people are the right type of people for the retirees that need the help, need the support, and we're there to do it. In fact, we even give out our call center operators that handle the retirees will give direct dial instructions. So if they have to call back on an issue, if it's not resolved, they'll be able to dial right back into the exchange, into the person that's helped them in the past, instead of going through the series of different people and explaining everything all over again. They'll go right to that operator that helped them in the past.
And then there are informational meetings as well that you'll be part of.
Yes, exactly. We're looking forward to that. We've got 5 meetings set up. I'll bring staff from our offices in Rhode Island, and also we have some local support with our consultant team here in Detroit, in the Southfield area. And there will be meetings, and they'll be very interesting meetings. We do these all the time, and people, I think, get very happy when they listen to the couple of things that we tell them.
Okay.
The most important thing they're interested in is my doctor and is my practitioner in the network? And can I use the same pharmacy that I use now? Those two questions invariably dominate the discussions. And once we explain to them that yes, they can use their same doctors, and yes, Medicare can travel through all 50 states, and yes, they can use the same pharmacies and the same druggist, it just takes all their fears off them. And that's something we expect to hear that very often in the upcoming meetings at the beginning of October.
So if a retiree doesn't really know what to do, they get the packet and they want to talk to somebody, they can.
They can. They can talk to us in person at the meetings, or they can call the 1-800 AmWINS number that's been set up, which you'll have on their kits that come in the mail. And it'll also be published on the Wayne County website. We have a link to the AmWINS site that you can go from the Wayne County site to our site directly and toggle back and forth if that's what they'd like to do.
In doing this for over 20 years, this is something that your company knows and something that you can really explain and help the retirees
Absolutely.
understand.
We've grown to be the largest retiree healthcare administrator in the country. We have upwards of 450,000 clients that are either pre-65 or post-65. Essentially, we've done that for a reason. We've grown that way for a reason, is because we're the best at it. And we take it seriously. And every retiree is treated with respect, with dignity, and we don't rush retirees off the phone. There's no time limit as it relates to how long a particular call center operator can speak with a retiree. They speak as long as they have to speak to get the issues resolved.
And I would think too, you have to go by case basis. Every retiree has a different question. They have different questions.
No question about it.
So you can't kind of cookie coat this.
No.
You can't just blanketly
Not at all.
do this.
There's so many things that the retirees don't even consider that our staff will bring up to them. For example, if you select this plan, will the drugs that you're taking be covered with this formulary? It's a key question. Will the doctors that you're seeing now be part of the network? Key question. And they sometimes don't think to ask those questions, and we help them walk them through the process, because all of these things are important. And while they might not know it's a question at the time, they will if we don't give them the right answers when they're engaging us on the phone.
So Ed, you're confident that whether they call or whether they go online or whether they come to one of the informational meetings, that when it's over, when it's done, they would know everything they need to know about the healthcare change?
No question about it. In fact, I would say, Lloyd, that they will be more informed and more educated having dealt with the AmWINS team than they were before with regard to what their health care is. And it's a very important thing to know about health care. As we all know, it's changing dramatically. So this is going to help them through the process. Ed
McManus, Senior Vice President of AmWINS and Sales, thank you so much for being here.
Thank you, Lloyd.
On Inside Wayne County, explaining all of that information. It's very important information. This was a very important show. Thank you so much.
Thank you so much. Nice to be here.
I'd also like to thank Tish King, Director of Wayne County Personnel and Human Resources, for participating in today's show. I'm Lloyd Jackson. I'll see you next time, Inside Wayne County.